You did a really good second round.
Okay. So my research project for this assignment was looking at the effects of a case-based learning experience on the development of PT core value development. And so one of the things that we recognize in our profession is that in order to successfully transfer from the classroom into the clinical environment, actually working with patients, there are really two core key components that you really want to see flourishing out of your students. One is just the basic scientific knowledge of being a physical therapist and understanding the human body, the human movement system. So all that science and theory that goes into treating a person with musculoskeletal dysfunctions. But the second thing that comes along is the professional behavior skills that when you go see a physician, you wouldn't want them walking into the room and slapping you high five and doing all kinds of acting all unprofessionally. That really makes an impact on how the person that you're working with perceives you as a clinician and how effective you can be. So there's really two things to successfully transition into the clinic, both that cognitive skill, did you learn what you needed to learn, but second, do you have those effective professional behavior skills and how good are they? So what the APTA, the American Physical Therapy Association, did was identify 7 specific core values that they expect the student graduates demonstrate once they leave their entry-level education. So what we're doing here on campus with their DPT degree. And so really it's up to the educators, the teachers of physical therapy to their students to create environments that will help foster both that cognitive and professional effective growth. And so the purpose of this research was to determine the impact of varied case-based learning experiences on the development of those identified core values that the APTA recognizes. So the research question was, what effect does type of case-based learning experience in the orthopedic classroom have on PT, physical therapy, core value development in student physical therapists? And that's what we were trying to look at. So the theoretical framework in this case is inquiry-based instruction. And inquiry-based instruction is a form of instructional method where the students are first presented with a problem or a question. And the reason why I really like this form of an approach, not only of instruction but theoretical framework, is this is exactly what your working clinicians go through on a daily basis. Every time a new person steps in front of them and says to their physical therapist, I'm coming to you today because I have this shoulder pain and it's been going on for a few weeks. You're immediately presented with a problem that now you have to work through and figure out. And that's exactly what this type of instructional method works and aims at. They present the student or group of students with a problem that then they need to start to work through. And then in the educational world, what ends up happening is the students have to attempt to solve those problems. And along the way, they might start to realize, well, maybe for the shoulder, I really need to know the anatomy really well at the shoulder, but I don't know it as well as I'm supposed to. So they understand, they come to learn that there's a knowledge gap. They have a knowledge gap that then they have to fill. And so through filling those gaps, that's when the new learning occurs. As the facilitator, as the educator, as the teacher, it's not your job to dictate what's being learned, but just to facilitate the process as they're moving from the beginning of the problem towards the end of the problem. And so inquiry-based instruction falls under 4 different umbrellas: inquiry-based learning, problem-based learning, project-based learning, and case-based learning. And the project-based learning, case-based learning, and problem-based learning, those 3 can be done in a group setting and generally are described as being more of a group learning activity. And so what we found in individuals that undergo peer learning, there's a lot of literature, especially in younger individuals, the K through 12 literature, that starts to suggest that not only does group learning improve those cognitive skills, but having to work together in that social context starts to improve those effective behaviors like communication and respect for others that we want to try to develop within our students as well. So looking at the actual literature review, problem-based learning is the most commonly investigated. Problem-based learning is a type of learning where the problem is presented to the student before they are given any background information about that topic. So that could be a problem concerning someone with shoulder problems before they've ever had any knowledge or any facilitation from the teacher about anything about the shoulder. Okay? Studies have shown both positive cognitive growth and effective domain growth with studies that have looked at this type of inquiry-based instruction in the PT literature. Case-based learning is the second most common that's in the literature. It's been found to increase both cognitive ability, and that students tend to have a very strong preference for this learning style. So having to be in that group experience, they prefer that better than just sitting and listening to the teacher talk to them for 2 hours. So far, from what I've found, there's been no studies looking at project-based learning. Project-based learning is when the students are given a problem and are expected to have a physical project completed by the end, that the project is actually the entire experience, that they're always working towards that project. Case-based learning differs from problem-based learning, that in problem-based learning, you get no formal instruction on the topic before you're presented with the problem. In case-based learning, you are given a little background information before being provided with the problem. So case-based learning is a very common one used in classrooms within the PT educators, but it's the second most common that's been researched. So the methodology, this was a pre-experimental alternative treatment post-test only with non-equivalent groups design. And so the independent variable were the different case-based learning experiences that they had to go through, and that would differ by body region. So one group of students were given a problem and a case scenario in the shoulder, another one at the elbow, another one at the wrist. We also did groups at the hip and knee. So there were different body regions, and that's what we're going to try to see is were there differences between the groups that worked on the different body regions, with the dependent variable being the APTA core values assessment. And then the reason why this most significantly lends itself to more of a pre-experimental design than a quasi-experimental design was the researcher, meaning me, did not assign any of the groups. The students, the subjects of the research were allowed to sign themselves up for which group they wanted to work on at the beginning of the semester. And because of that, differences between groups could be due to the groups being different before implementation, and that comes from Campbell and Stanley. It's probably the biggest reason for me why this ended up falling under more of a pre-experimental design than a quasi-experimental design. So the way this worked, each group was provided with a hypothetical paper case scenario, and those cases differed by the body region. So one group had to work through a shoulder problem, a paper case on a shoulder problem, another one a knee problem. And so the first thing they had to do as a group was come together, look at that basic background information, and come up with a differential diagnosis. Well, in the shoulder, we think it could be diagnosis 1, 2, or 3. And so then with the teacher facilitator, we would have a further discussion about what their hypothetical diagnoses were and how they were determining which ones they were and which one did they think was most likely, just given that basic information they were given to begin with. And then after that discussion, those students were provided with further information and told to concentrate on one of those particular diagnoses. And then what they had to do was, as a group, they had to create and demonstrate a plan of care for that person. So they had to come up with the manual therapy techniques, the exercises, the education, everything they would do with a person if they had that scenario. And not only be able to tell us what that plan of care is, but actually do it, actually perform it. So then we would randomly tell them, okay, you said you wanted this person to do this type of exercise. Can you make that happen in front of us right now? So they have to be able to actually create it. So it was a combined working it through in your minds as a group, but also then being able to actually do it with your hands. The dependent variable, like I said before, was the APTA core values assessment tool. It's a 5-level Likert survey. And what you're going to do is for each question, you're going to answer how often do you feel like you demonstrate that activity. So for this case-based learning experience, how often do you think you demonstrated these particular core values, with a 1 being never and 5 being always. There were 7 different core values. And for each core value identified, there are 5 to 12 sample indicators. So for the very first one, which is accountability, there are 12 questions you answer that are supposed to all be related to accountability. And so you move like that through the 7 core values. There's between 5 to 12. Like I said, accountability had 12. And so for a grand total of 68 sample indicators. So there were this was a 68 item survey that they had to check off, okay? And within that assessment tool, they are presented with one, the history of the core value development, why the APTA developed them and selected the core values they did, and then also they are provided with instructions on how to use the tool and how to fill it out. So those instructions are provided to the students when they're given the assessment tool. And so what we have from a descriptive standpoint is that there were 4 individuals assigned to the shoulder group, 6 for elbow, 4 for wrist, hand, 6 for hip and knee. There were 14 males, 12 women included in the study for a total of 26 individuals with a mean age of 24.92 years. And so the idea was to determine to compare the core values as a whole. So it was determined to instead of looking at 68 individual scores line by line and see if there was significant differences, let me take the 12 that make up accountability, combine them all, and let me just look at accountability as a whole. Let me just look at altruism as a whole. And so what I did was I took all of their numbers individually and I added them all together. And then what I did was I ran a reliability analysis based on those whole numbers and found that 3 of the 7 core values met a reliability value that was worthy of inclusion, so greater than 0.7. And those were the core values of excellence, integrity, and social responsibility. And you can see what the Chromebox Alpha levels for those were. All the other core values, the other 4, met a reliability level of below 0.7, and so they were not included in the analysis. So what I did was a one-way ANOVA to compare the mean scores between groups. So I wanted to compare excellence, integrity, and social responsibility between groups. And then I did a Bonferroni post hoc analysis because if it did come up that, yes, there's a statistically significant difference for excellence, what I don't know at this point, were all 3 groups different from each other? Was only one of the 3 groups or 6 groups different from each other? So we had to do a post hoc analysis on that. And what ends up happening is we really didn't have anything that was statistically significant or meaningful. So the only one that came maybe even remotely close was excellence, but even that was at an alpha level of 0.29, so 29% chance of a type 1 error, which is not good. Integrity was significantly worse, and social responsibility was somewhere in between.
That's very similar.
So what does that tell me? That tells me that these data do not support differences between groups on levels of core value self-assessment. The Bonferroni post hoc analysis revealed only one interesting finding where when you compared the knee group to the shoulder group, the p-value was at 0.34, where every other comparison for every single reliability measure, for every single ANOVA measure, the p-value was set at 1, so they weren't even close to being different from each other. So that was the only one, if you want to say there might have been a little bit going on here, but even that wasn't statistically meaningful at all. So that's what happened there. Are the results disappointing? Always when you don't get statistical significance, but honestly not surprising. I think the big thing is the only thing that differed between the case-based learning experiences was what body region they were working in, shoulder versus elbow. But the final expectations for them to develop a plan of care and have to produce that was all similar across the board, okay? Also, it's not surprising because of the pre-experimental nature of the design. It wasn't a very strong study design to begin with, so I expected it to not see big differences. I think the biggest flaw was not assigning the groups. That immediately lent itself to being a pre-experimental design. There was a lack of control group, so I could never compare pre or post test. So a big thing here is maybe every single group did significantly improve from before the experience that they had, but they all improved maybe the same amount. So when I compare them afterwards to each other, they're not different from each other, but they could have been different from before I started. So having a comparison group or some kind of a control group would have been more helpful there. I can't speak to if I had to guess, I would probably say probably not, but you can't be sure unless you do it. So in the future, we definitely want to work on randomizing groups. Group randomization is very important, especially when you're wanting to infer any type of generalizability, or if you want to infer any type of clinically meaningful, real-world meaningful results, having larger sample sizes would be helpful. This was only 26 individuals total for this sample group, so having a larger number could have been better. Definitely the inclusion of a comparison or some type of a control group so I could see differences from before and after. And to increase the differences between the case-based learning experiences, maybe have specific different outcomes that each group needs to work towards, could have made some differences there. Are there any questions? There you go. Thank you.
Do you guys ever, like in class, just break down